What the backdrop, what the comments you've heard represents is several million Kentuckians could get insurance through an association. We're one of the states that's lucky enough to have health associations, but they're only within our state. Imagine, though, if we went beyond state lines. The National Restaurant Association, I think, said you have 1 million members. So 1 million members, but imagine how many employees. And these are people who want to get insurance for. Sometimes low wage to begin with, younger, may not have insurance when they first start working in a restaurant. Many can get it, but can you imagine if, let's say, 1 million restaurants, it might be 5 million workers. Can you imagine a health association with 5 million workers going to the insurance company and saying, we want a lower price, we want it to cover pre-existing conditions, we want it to cover, I think there's almost nothing that you couldn't do with the leverage of 5 million. You would be the biggest corporation in the country. You'd be bigger than any of the biggest corporations. But we have some already working here. Here in Louisville, St. Matthews has one I discovered. They have 1,000 people in it in the Chamber of Commerce. But there would be an advantage. Cattlemen's or any of these associations that you joined, one of the advantages and perks of membership would be you would be able to get, maybe you get your insurance through it. And it is really where the problem is. The problem is the individual market. The problem is mom and pop have a plumbing business, and it's mom and pop, and that's just them. Mom gets sick or pop gets sick, and all of a sudden their insurance goes through the roof. No one will cover them. In that individual market, 50% of the country only has one insurer now. What's great about this situation is it doesn't require a mandate. It requires liberalization of the law. It requires more freedom to let people associate across state lines. But you can imagine all kinds of groups. AARP has 33 million people. Can you imagine the leverage they would have if they were negotiating as a body with the insurance company? I think if you were a credit union or the Chamber of Commerce, you'd say, you know what, I might get more customers if everybody knows that if I put my money in a credit union, I can also get power to get less expensive health insurance. Same with the Chamber. I'd be much more inclined to pay my money to join the Chamber if I knew I was going to be part of group insurance, particularly if I'm by myself and it's my wife and I and my kids buying insurance. Who wouldn't want to? In fact, I could conceive of big enough associations that nobody's left in the individual market, or it's so small that the people in the individual market who can't get it or don't have the financial means, we end up taking care of in a different way, maybe with government help, but there'd be very few left. So instead of, I think there's about 10 million people in the individual market, I could conceive of a possibility that 90% or more leave, because who would really stay? Who would want to buy insurance? I think it's unfair to buy insurance. For a man and a wife to have to buy their insurance on their own is unfair. And it's an anomaly of the tax code dating back to World War II.